Have you ever wondered how a virus no larger than a pixel on your screen can cause a global pandemic? It's a thought that may have crossed your mind, especially in the context of HIV/AIDS. This disease, despite its minuscule size, has left a colossal impact globally, affecting millions. It's a complex web of biology and human behavior, a silent and insidious enemy that demands our understanding. Today, we'll unravel the mysteries of HIV/AIDS, a disease that has affected millions worldwide. So, what exactly is HIV/AIDS? Well, let's start with the acronyms. HIV stands for Human Immunodeficiency Virus, a virus that specifically targets the immune system, the body's defense against disease. AIDS, on the other hand, stands for Acquired Immune Deficiency Syndrome, a condition that arises when the immune system has been severely damaged by HIV. Now, it's important to understand that HIV and AIDS aren't the same thing. You can have HIV without having AIDS. HIV is the virus that infects individuals, and AIDS is the condition that occurs when that infection has severely compromised the immune system. Let's delve a bit deeper. HIV attacks the body by destroying a type of white blood cell, known as CD4 cells, which are crucial for the immune system to function properly. By doing so, HIV weakens the immune system, making it easier for other diseases and infections to take hold. Now, HIV infection can be categorized into 3 stages. Stage 1, often referred to as the acute infection stage, is characterized by a rapid increase in HIV in the blood. This is when individuals are most infectious. Stage 2, the clinical latency stage, can last up to several decades with treatment. HIV is still active but reproduces at lower levels. Some people may not have any HIV-related symptoms but can still transmit the virus. Finally, we get to Stage 3, AIDS. This is the most severe phase of HIV infection. People with AIDS have such badly damaged immune systems that they get an increasing number of severe illnesses. Without treatment, people with AIDS typically survive about 3 years. So, there you have it. HIV is a virus that attacks the immune system, and AIDS is the condition that signifies severe damage to the immune system by HIV. The progression from HIV to AIDS involves stages of increasing severity, with the virus gradually weakening the immune system until it can no longer fight off diseases and infections. Understanding the nature of this virus is the first step in combating it. How does this tiny virus spread from person to person, and how can we prevent it? This is a critical question, and the answer lies in understanding the transmission methods of HIV/AIDS along with the preventive measures. Let's start with transmission. The HIV virus can be passed from one person to another through certain body fluids: blood, semen, vaginal and rectal fluids, and breast milk. It's important to note that the virus doesn't spread through casual contact, like shaking hands or sharing a meal. The most common ways HIV is transmitted are through unprotected sex, sharing needles, and from mother to child during birth or breastfeeding. Now, how can we prevent the spread of HIV? Well, there are several effective strategies available. The first is consistent and correct use of condoms. Condoms act as a physical barrier, preventing HIV and other sexually transmitted infections from passing between partners during sex. Another preventive measure is needle exchange programs. These programs provide clean needles to people who inject drugs, thereby reducing the risk of HIV transmission through shared needles. They also often provide other health services, including testing and counseling. Then we have pre-exposure prophylaxis, commonly known as PrEP. PrEP is a daily medication that can significantly reduce the risk of getting HIV from sex or injection drug use. When taken daily, PrEP is highly effective. For those living with HIV, taking antiretroviral therapy as prescribed can also prevent transmission of the virus to others. This strategy is known as treatment as prevention. Finally, regular testing is a key component of prevention. Knowing your status allows you to take the necessary steps to protect yourself and your partners. In conclusion, preventing HIV is not a matter of luck or chance. It's about understanding how the virus is transmitted and taking the appropriate precautions to protect yourself and others. Preventing HIV is a matter of practicing safe behaviors. Is HIV/AIDS a death sentence? This question may have been valid in the early days of the pandemic when treatment options were limited. However, the landscape has dramatically changed, and the answer is a resounding no. Now let's delve into the world of antiretroviral therapy, or ART for short. ART is a combination of medicines used to slow the rate at which HIV multiplies in the body. It's not a cure, but it's a powerful tool that can help people with HIV live longer, healthier lives. With ART, HIV is considered a chronic manageable condition, much like diabetes or heart disease. So, how does ART work? Picture a battle scene where HIV is the enemy and your immune system is the defending army. HIV is crafty, constantly multiplying and attacking your immune cells. When left unchecked, it can overwhelm your body's defenses. That's where RT steps in. It's like reinforcements arriving just in time, slowing down the enemy's advance and giving your immune system a chance to regroup and fight back. The success of RT depends on several factors. One of the most crucial is early detection. The earlier HIV is detected, the sooner ART can be started and the better the outcome. Early treatment can help keep the virus in check and delay or prevent progression to AIDS. Another key to successful treatment is adherence. ART is most effective when taken consistently as prescribed. Skipping doses can give HIV a chance to multiply and become resistant to the drugs, making treatment less effective. While we've made great strides in the fight against HIV, there's still a lot of work to be done. Researchers are tirelessly working towards a cure and better treatment options. In the meantime, the importance of early detection and treatment cannot be overstressed. In conclusion, living with HIV today is vastly different from what it was 3 or 4 decades ago. It is now a chronic, manageable condition, not a death sentence. Medical advances have transformed HIV from a fatal disease into a manageable chronic illness. Though there is no cure yet, HIV is certainly not a death sentence. What does it mean to live with HIV/AIDS? Picture this, a life filled with regular hospital visits, daily medications, and the constant need to monitor one's health. This is a snapshot of the life of someone living with HIV/AIDS. But remember, it's only one side of the coin. The other side? It's a life that can still be full of hope, resilience, and strength. Living with HIV/AIDS is not just about managing the physical aspects of the disease. It's a holistic experience that also involves tackling emotional and psychological challenges. The uncertainty and stress can be overwhelming. It's like fighting a battle on multiple fronts. But don't forget, battles are not fought alone. Support systems play an invaluable role in this journey. A strong social network of family, friends, and healthcare professionals can provide both practical help and emotional support. This network can be a source of strength, offering encouragement during tough times and celebrating victories, no matter how small. But what if this support system is not in place? This is where mental health care steps in. Mental health professionals can provide strategies to cope with stress, deal with stigma, and maintain a positive outlook. Remember, mental health is just as important as physical health in managing HIV/AIDS. Stigma and discrimination, unfortunately, are still prevalent in many societies. This can lead to isolation and make it harder for individuals to seek help and support. It's important to challenge these harmful attitudes and create a more inclusive society. After all, everyone deserves respect, dignity, and the right to live a full life, regardless of their HIV status. The journey of living with HIV/AIDS is not an easy one. It's a road filled with challenges and obstacles. But with the right support, treatment, and a resilient spirit, it's a road that can lead to a life that's as normal as anyone else's. Living with HIV/AIDS is not easy, but with the right support and treatment, one can lead a normal life. Why is knowing your HIV status so important, you may ask? Well, let's dive right into it. Getting tested for HIV is not just about checking a box in your health routine. It's a crucial step in taking control of your health and your life. By knowing your status, you can make informed decisions about your lifestyle, relationships, and healthcare. Regular HIV testing is key for early detection. The sooner you know, the sooner you can start treatment if necessary. And here's the thing. HIV is no longer the death sentence it once was. With early detection and proper treatment, people with HIV can lead long, healthy lives. Now, let's clear some of the fog around HIV testing. It's not a test of morality or character. It's a simple medical procedure, just like checking your blood pressure or sugar levels. So there's absolutely no reason to feel ashamed or scared. And remember, HIV testing isn't just about you. It's about your loved ones too. By knowing your status, you can take steps to protect them. So let's break the stigma. Let's normalize regular HIV testing, and let's ensure that we're doing our part in the fight against HIV/AIDS. Remember, knowing your HIV status isn't just about you, it's about protecting those you care about too. So get tested, know your status, and help fight the spread of HIV/AIDS.